Good day. I'm Tina Sandry, CEO of Forest Hills of Washington, D.C. I'm a licensed administrator and also a certified quality professional. This year, I also have the pleasure to serve as the D.C. Healthcare Association Chair. Today, we're here to talk about how to support vaccine acceptance rates. In our community, our vaccine rates for our workforce went from 54% to 64 to 80 to 86 at each of our clinics, and we're still climbing. Our overall strategy was to use our corporate values as a nonprofit of compassion and respect as filters for all of our decisions on how to roll out our vaccination program. Additionally, because of COVID, we included a trauma-informed care approach that enabled people to maintain as much control over their decisions. Just as we would in person-centered care, we applied those values to our workforce. We listened to people's fears, concerns, and questions, and then worked to connect science-based, evidence-based information in response for people's need for information in culturally competent ways. From a personal standpoint, as a yoga instructor that teaches mindfulness to our leadership team, our team focus was on addressing concerns in the present mode rather than looking at a future end goal, such as herd immunity. This had the additional benefit of increasing workforce engagement, since workforce matters were a top challenge for us pre-COVID, and they certainly will be a challenge for us post-COVID as an industry. In the beginning of our journey, our workforce was very focused on the newness of the vaccines that had just come into discussions in the general news and population as of December 2020. So it was a challenge to go to the future, so we stayed in the present. The top 4 things that we did overall were to, number 1, demonstrate cultural sensitivity by trying to present information from people who looked like and sounded like our team members. 2, to diversify our communications methods. If it was important enough to be said and become our message of the week, we tried to say that message in 8 different ways, such as email or phone or text, huddles, flyers, posters, displays, videos, etc. Communications considered audio versus visual learners and analytical versus relational thinking styles. And the third thing we did was to educate to empower. We encouraged people to educate themselves so they could make an informed choice for themselves, their family members, and those people that they might impact in their circle who might be immune compromised individuals. And the fourth thing that we did was we kept politics on both the left side and the right side out of the communications. We instead extended compassion and respect for all of our workforce and residents, regardless of political affiliation, and we tried to stick to scientific evidence-based focus. These methodologies are not groundbreaking. You can implement this in your teams, and you will produce results in your community with time and commitment from your leadership team. It takes a village to protect the village.